Thank you so much, my good friends. So with the heart, we said the first thing you want to do is identify the anterior side of the heart, and my heart is so bad. We said we use the anterior interventricular sulcus. It will be sloping from the right side to the left side, okay? Anterior interventricular sulcus, and we said you confirm it because you see the pulmonary trunk right in front, right there, okay? And then we said once you have identified the interventricular sulcus, the anterior interventricular sulcus, you know that this is the right ventricle, this is the left ventricle, okay? And then we will continue on identify all the external structures, and then obviously this is the left auricle, this is the right auricle, right? We've already identified the pulmonary trunk, okay? So there is the aorta, and you can see the brachiocephalic trunk here, the aorta, okay? We know it because it's coming to the left side. On the diagram? Yeah. Which one? The aorta? The brachiocephalic trunk I didn't, because it's really something that, it's a branch of the aorta. So all I need you to know is the four major great vessels into and out of the heart. And if you are lucky, sometimes we see the brachiocephalic, branch trunk, which is a branch from the aortic arc, right? And you know those three other branches, those two other branches on the aortic arc, right? The left common carotid and the left subclavian, right? And you probably won't see them here because it's cut off short. Okay. All I need you to know is the aorta. Okay, which is this aorta. Okay, I just couldn't ignore the brachiocephalic trunk because it's there. Okay, I just had to show it to you. Aorta, pulmonary trunk. Okay, and then if I point to this sort of left side, and I'm like, what is that major blood vessel? You know to say pulmonary veins, even though you don't see them because they all get cut off, when they take the hearts out. Okay, so you know to say pulmonary veins. But if I say what's that structure, you would say left auricle. You understand? If I'm on the right side, okay, and I'm like, what's that major blood vessel? You'd say vena cava, or inferior vena cava, superior vena cava. I'll take all of them, okay? Because you know that's the one that enters the right atrium. Okay, but if I say what's that structure, then you would say auricle. Right auricle, yeah. You see what I'm saying? So again, you kind of have to be switched on, and you kind of have to read the question so that you know what I'm looking for. Sometimes the question describes what I'm looking for too. Okay, so very good. So we've identified all the four great vessels into and out of the heart. We have identified the anterior interventricular sulcus, and just for good measure, I can show you this one. The posterior interventricular sulcus is vertical. Okay, very good. So now we cut from the left side, and we open and see what's inside. Okay, and then this will be the bicuspid valve, mitral valve, left atrioventricular valve. This is chordae tendineae. Chordae tendineae. These are papillary muscles, and this is trabecular carni, these big muscular ridges in the ventricles. Obviously, this is the left ventricle, and this is the right ventricle, and this is still the left ventricle. So this is still the mitral or bicuspid valve. Okay, and then obviously this one here on the right side, this will be the tricuspid valve, the right atrioventricular valve. And then you could see here, going into the aorta, this valve would be the aortic semilunar valve. This is the interventricular septum, okay? And this small muscular ridge is in the auricle. This happens to be the left auricle. That will be the musculi pectinati or pectinate muscles. And all these are coming in the exam, okay? I'm just telling you. And then I cut my pulmonary trunk so we can see the cusps of the pulmonary semilunar valve. Okay? And this is the right side because it's the small side, and you could see this one is the moderator band or septomarginal trabecular. Okay? The moderator band kind of sort of regulates the right side so it's not pumping with too much pressure, because it's going to the delicate lungs, and the lungs are very close by. So this is the moderator band. You don't find it on the left side because the left side has to generate a lot of pressure to go into the systemic circulation, okay? All right, my good friends? So those are all the structures internal and external for the heart, and then you could switch it off.